My topic is elimination of HPV-associated cancers in Israel. I will start by introduction, very short introduction. So what you see here is a consensus position paper about the strategy for the elimination of tumors caused by HPV in Israel. We set together those logos belong to various Israeli societies. For example, the Israel Society for the Study and Prevention of Sexually Transmitted Infections, the Israeli Society for Infectious Diseases. We also had the Israel Society for Colposcopy, Pediatrics, and the Israel Society for GYN Oncology. And we also had the 4 HMOs in Israel. We all came together to prepare this consensus position paper because after the WH initiative, in Israel, the Ministry of Health took very good steps, but we didn't have a consensus paper. So we sat together and prepared one. And at the end of my presentation, I will talk about a few of our recommendations. Now, let me give you a perspective of the HPV-associated morbidity and mortality in Israel. So in Israel, the incidence of cervical cancer is 5.64. Of course, not the highest in the region, but altogether, as you see here, we have 11.88 per 100,000 HPV-associated cancer, and in men, 7.36, which altogether is quite high. One of the issues in Israel is the mortality is relatively high. While when we're talking about incidence, we are very low. We are included in Western Asia, so we are like the lowest rate in the world. But if you talk about mortality, we are higher. So the mortality rate is still high, maybe because of the lack of attending to screening, or maybe because the low rate of vaccination, which I will talk now. So what about screening in Israel? 70% is the rate by the WHO. Here in Israel, cervical cancer screening is included in the healthcare services basket for women aged 25 to 65. That means that they do not need to pay for that. All 4 health maintenance organizations employ now HPV screening methods as their screening approach. Nevertheless, the approach to screening here in Israel is opportunistic, as a national organized screening program has not been implemented. So when we compare the compliance with cervical screening to the United States in green and to the United Kingdom, we can still see that we are the lowest among all these. And one of the reasons, again, is because we do not have a national screening program. Let's talk about immunization first at school. So 90% is the aim of the WHO in order to achieve elimination. Unfortunately, in Israel, although we have a very high compliance with other vaccination at first graders and at 8th graders, with HPV, the compliance for the first dose is 64.9, and for the second dose, it's only 51.7. These are the last data from last year. And if we try to divide it and understand why we have such a low rate or low compliance of vaccination, let's first divide it by areas. So this is the north area where there is a high compliance, but in Jerusalem, for example, there's a very low compliance. Probably the reason is because in Jerusalem there's a higher concentration of Orthodox Jews, Haredik. In the south, there's an issue with the nurses, not enough nurses to give the injections. But altogether, we see that it is only 51.7 for the second dose. We are giving 2 doses up to the age of 15 as of now. If we further go in, we see that in the secular sector of the schools, actually there's, I would say, a high rate, a relatively high rate of vaccination. However, in the religious sector, it's lower, and in the ultra-Orthodox, the Haredic sector, it's only 8% for first dose and 6% for the second dose. So definitely there is a lower rate of coverage in highly religious sector, and I wonder if this is the same with your countries. We'll discuss that. By the way, in the United States, they have already found that there's an 11-fold decrease in HPV vaccine completion rates among states with a higher percentage of religious adults. They ask people, what is your religion? Are you Orthodox or less Orthodox? And here in dark is those countries where most people declare that they are highly Orthodox, and in these countries there's a lower rate of vaccination. So I would say that religiosity, the more religious you are, or the more Orthodox you are, the less vaccination you get. What do we do in Israel about that? So this is a challenge for us. We discussed that with PUA. PUA is an institute in Israel that deals with fertility and medicine in accordance to the halacha. In the halacha, they try to avoid vaccination at age 14, like we give it in Israel, because this is the puberty age, and they don't want to deal with issues that have to do with the relations in this age. So what did they say? In consultation with leading rabbis and senior physicians, they recommend to administer the vaccine in fourth grade. And I am happy to say that recently the Vaccine Council accepted our position, and starting last year, hopefully, we will give the vaccine at the fourth grade. By the way, 1 dose at fourth grade, the second dose will be the eighth grade. By the time they will arrive to eighth grade, we will see if 1 dose is enough, but probably they will get the second dose at the eighth grade. The Orthodox people also were impressed by the data of HPV affecting fertility. There are many reports. My group has performed a meta-analysis, and what we found is that the prevalence of HPV sperm infection was estimated at 16% of the population of infertile patients. Probably the HPV comes from epithelial cells that end up in the sperm. But anyway, once a sperm is infected with HPV, you see there is a decrease in the motility, for example, and HPV infection lowers sperm count, motility, and morphology. Here you see that it also increases the spontaneous miscarriage rate. Another issue, so this is very important. The other issue with HPV and fertility is that once you develop a precancer and there's a need to do a loop excision, that may, in the long run, decrease fertility because of premature deliveries and late abortions. So this also affects the Orthodox population, and they indeed want to get vaccinated, but an earlier age. Moreover, initiating the HPV vaccine series at age 9 is advocated not only by the ultra-Orthodox, but by many organizations, for example, the American Cancer Society, who recommend HPV vaccination started at age 9. And I'll remind that in most countries, the vaccine is registered since age 9. It's given later, but we can start giving it at age 9. Some of the benefits of starting vaccination at age 9 is that more adolescents start and finish vaccine series on time while they're on school. because if they start later, they may end up or leave school before they complete the vaccination schedule. There is a stronger immune response to the HPV vaccine as we are younger, so it's better to give it at 9. Increasing likelihood of vaccinating prior to the first HPV exposure, which is earlier and earlier these days. For the Orthodox community, fewer questions about sexual activity are asked at age 9, much before puberty, than at age 14, in the middle of puberty. Fewer shots per visit. As younger you are, you get less injections. It is highly acceptable to system providers and parents at this age. I want to talk now a little bit about adult vaccination, because if we go back to the vaccination coverage in Israel, I showed you how it differentiates from a country, from a town to town. But you see that over the years, we got up to 65% in 2016. It dropped a little bit because of some fake news, but we never came back to this rate. And it looks like to me that we have a glass ceiling. We arrived at this compliance in school, but we cannot go over it, despite all our efforts in discussing it and explaining the importance of the vaccination. Of course, we can do more and we will do more, but for some reason we are stuck at this percentage, like a glass ceiling. So we thought about that those pupils, those students, when they reach 18, let's give them the option to be vaccinated. And you know the data that show that the vaccine is effective even after age 18, even after HPV exposure. So why not using it? So we received from the Ministry of Health the opportunity to vaccinate from 18 to 26. Unfortunately, it's every year, like a catch-up. And we ask that to be continuous, to give the vaccine to all adults from 18 to 26. And we also recommend the catch-up practice to vaccinating age 18 to 26. Let's see how many vaccinated when the Ministry of Health introduced it to the health basket. So in the 2021, the first year that the Ministry of Health introduced the catch-up practice, only 9,000 were vaccinated. This is extrapolating from 2HMO data. More than 2022, and in 2023, 20,000 vaccinated. That's why we want the catch-up to continue, because unlike other countries where the vaccination in school reaches 90%, we are still low, so we can build upon the catch-up practice. By the way, 84 to 87% of the vaccinated are women, so men needs to be educated too. There are some issues when we investigated what happened when somebody at this age get a prescription. So only 40% of the prescription actually were not redeemed. Only 60% took the prescription from the physician and went to get it. A drop of 20% between the first and second dose, and a drop of 20% from the second to third dose. At this age, we give 3 doses. So definitely we need to work on the vaccination journey to make it easier. For example, let the nurse prescribe and vaccinate. Actually, no need for the physician to prescribe. This may help. Remember, this was free of charge. They could get the vaccine at this age without paying, and still there was a drop from 1 to second to third. So we also recommend the HPV faster. We are trying to introduce it, the Bosch idea. So every woman who comes at 25 to get the first screening, we start screening at age 25 with HPV test, recommend the vaccination to her. The HPV screening is free, and the vaccination at this age is free. And then you continue. If she has not been vaccinated, you can offer the vaccination later. Those 90 to 95% of those will be HPV negative. So, of course, the HPV vaccine will be protecting for them as if they received it when they were younger. And the 5 to 10% who are HPV positive also benefit from the vaccine, as El Mayura just showed, that the HPV vaccine after treatment in the vulva, vagina, but also in the cervix is very beneficial. So we recommended the HPV faster. So in Israel, because of the 50% rate of vaccinating the boys and girls at school, we are hoping that the adult vaccination will take up the issue. And as you know, HPV faster is helping because this is the fastest way to receive elimination. So let me go back to the strategy that we wrote according to all these considerations. I won't bother you with all our recommendations, but here are some. The first is that the goal for the complete vaccination rate by 2030, probably it will be later, should be at least 90% for both girls and boys. One of the questions I like to pose to the esteemed panel is that we are having a gender neutral vaccination for some years. Should we stay on a 90% goal or go down to 80%? We'll talk about that. We didn't want to change the WHO criteria, so we left it so far on 90%, but that can be still discussed. We also wanted to promote a long-term plan, continue including the HPV vaccine to the health basket at age 18 to 26 to allow for continuous catch-up. We recommend continue vaccinated both girls and boys, the gender neutral, within the school framework, and to start vaccinating at age 9. Regarding the religious leader, to update them that HPV infection can harm fertility and indirectly cause preterm births. That will maybe encourage them to get vaccinated. We also discussed simplifying the vaccination journey, as I just said, allowing nurses to prescribe and vaccinate, to introduce the vaccine in the travel clinic. We have travel clinics for Israelis before they go to travel various countries. Vaccinate those diagnosed already with HPV carrier status or a precancerous condition caused by HPV, like in Portugal. Vaccinate without an upper age limit. Currently, the upper age limit in Israel is 45 years of age, and we would like to give it without an upper limit for many reasons, because quite a few persons need a vaccine even after 45. Regarding screening, we would like that 70% of the women will undergo the HPV test every 5 years. We change it with the HPV test from every 3 years to every 5 years. Introduce self-sampling for HPV testing for populations who have not undergone cervical screening in the last 5 years because they won't come, or those who have difficulty accessing a clinic for screening. We have started with self-sampling mainly as a pilot, but I think that it has a place for those who would not come otherwise. Provide HPV vaccination to cervical screening time, the HPV faster when they come for screening, add the HPV vaccination at the same time. Screening for anal cancer and vaginal cancer in risk groups. We also had a recommendation regarding treatment and a recommendation regarding promotion of public and professional awareness of HPV issues, which are unique to Israel. And all that document have been provided to the Health Ministry, and we are waiting for their accepting it and adapting it. So I covered all my points. Thank you very much for your attention.